Have you ever woken up in the morning and felt like your mouth has completely dried out overnight? Your tongue feels sticky, your throat feels uncomfortable, and the first thing you want is the glass of water beside your bed. If you are over 60 and this happens regularly, you may have been told that it is simply part of getting older. But persistent dry mouth should not always be dismissed that easily. Sometimes it can be linked to a medication you take every day. In other cases, it may be connected to an underlying health condition that has not yet been noticed. And while drinking water can provide temporary relief, it may not address the reason your mouth has stopped producing enough saliva. Saliva is much more important than most people realize. It helps protect your mouth, supports digestion, controls harmful bacteria, protects your teeth, and even plays a role in protecting your airway while you sleep. That is why ongoing dry mouth is worth paying attention to. A study published in Scientific Reports in 2021 found that older adults who experienced dry mouth had a higher risk of mortality compared with those who did not report the problem. This does not prove that dry mouth itself causes serious illness. Instead, it suggests that dry mouth may appear alongside other health problems that are developing in the background. To understand this better, imagine a woman named Eleanor. She represents the experiences of many older adults rather than one specific patient. Eleanor was 69 years old and had always been careful about her health. For almost 2 years, she woke up every morning with an extremely dry mouth. She kept water beside her bed and drank several sips as soon as she woke up. During a routine appointment, she mentioned the problem. The answer was simple. It was probably aging, so she should drink more water. Eleanor followed that advice, but the dryness kept returning. The reason was simple. Water was treating the feeling for a few moments, but it was not treating the reason her saliva production had decreased. Saliva contains hundreds of important substances. Researchers have identified more than 1,000 proteins in saliva, including enzymes and natural compounds that help control harmful bacteria. One of its most important jobs happens while you sleep. Small amounts of fluid from your mouth can naturally move toward your throat and enter the airway during sleep. This is called microaspiration, and it can happen in healthy people. Normally, your body is prepared for it. Saliva contains protective substances such as immunoglobulin A, lysozyme, and lactoferrin that help control bacteria in the mouth. But when saliva production stays low, harmful bacteria can increase. As people age, the ability to cough and clear the lungs can also become weaker. That combination may increase vulnerability to respiratory infections. This became important in Eleanor's story. Over about 18 months, she had experienced 2 separate chest infections. She recovered after treatment, but nobody had connected those infections with the severe dryness she experienced every morning. The problem was not necessarily the water. The bigger question was why her saliva had decreased in the first place. And protecting the airway is only the first job saliva performs. There is another role that can affect something you might not expect. Your nutrition.saliva helps your body process food from the very first bite. Many people assume digestion begins when food reaches the stomach, but the process starts in your mouth. Saliva contains an enzyme called amylase that begins breaking down starch while you chew. It also softens food, makes swallowing easier, and helps you taste what you are eating. When saliva production decreases, foods that were once easy to eat can suddenly become difficult. Dry meat may be harder to chew. Whole grains may feel uncomfortable. Fruits and vegetables may require more effort. Over time, some people naturally begin avoiding these foods and choosing softer options instead. That can create a problem. The foods people start avoiding may be exactly the foods that provide the protein, vitamins, minerals, and healthy fats needed to maintain strength as they age. A person may still eat 3 meals a day and believe everything is fine, while the quality of those meals slowly changes. Research cited in the original transcript found that older adults with dry mouth were more likely to experience unintentional weight loss and inadequate nutrition. A 2023 review also linked dry mouth with lower intake of several important nutrients. This happened to Eleanor. She was still eating, but her food choices had changed. Foods that required more chewing became frustrating, so she moved toward easier options. Her weight slowly began to fall. The solution was not to remove healthy foods. It was to make them easier to eat. Adding healthy sauces, broths, or softer preparation methods can make nutritious foods more manageable. Saliva substitutes may also help before meals by making chewing and swallowing easier. But saliva has another important responsibility. Your mouth contains hundreds of different types of bacteria. A healthy mouth is not bacteria-free. Instead, it has a balance between helpful and harmful organisms. Saliva helps maintain that balance. When saliva decreases, bacteria linked to tooth decay and gum disease can become more active. This can lead to inflammation and damage inside the mouth, and the effects can extend beyond your teeth. Inflamed gums contain tiny blood vessels, and bacteria can sometimes enter the bloodstream when gum tissue bleeds. Certain bacteria can contribute to serious infections in people who are vulnerable, including infections involving the heart valves. There is also a strong relationship between gum disease and diabetes. Gum inflammation can make blood sugar control more difficult, while diabetes can increase the risk of gum problems. Researchers have also investigated possible links between gum disease bacteria and Alzheimer's disease. One study found certain bacteria associated with gum disease in brain tissue from people who had Alzheimer's disease. However, this does not prove that the bacteria causes Alzheimer's. The relationship is still being studied. The simple lesson is that your mouth is not separate from your body. And there is one more major job saliva performs. It protects your teeth. Saliva constantly covers your teeth with minerals and helps neutralize acids that can damage enamel. When saliva production falls, this natural protection becomes weaker. That is why some people suddenly develop serious tooth problems, even though they have brushed regularly for years. Dentists can sometimes recognize dry mouth by looking at patterns of tooth decay, gum irritation, and other changes. Even people who wear dentures can experience problems because the tissues underneath and around the dentures still need moisture. So saliva is doing far more than keeping your mouth comfortable. It helps protect your lungs, your nutrition, your oral bacteria, and your teeth. Now we have to ask the most important question. Why does saliva production decrease? For many adults over 60, the answer may be much closer than they realize. It may be sitting inside their medicine cabinet. For many older adults, medications are one of the biggest reasons persistent dry mouth develops. Hundreds of medications can cause dry mouth as a side effect. These include some blood pressure medications, antidepressants, allergy medicines, diuretics, bladder control medications, and certain sleep medications. The problem becomes more important when several medications are taken together. One medicine may cause only mild dryness, but several medications with similar side effects can create a much stronger effect. Doctors sometimes refer to this as anticholinergic burden. Certain medications interfere with nervous system signals involved in saliva production. When multiple medications have this effect, saliva production may decrease significantly. This does not mean medications are bad. Many are necessary and protect your health. The important point is that your medication list should be reviewed regularly, especially as you get older. That was a major part of Eleanor's story. When someone finally reviewed every medication she was taking, several were found to have dry mouth as a possible side effect. Individually, the effect might have seemed small. Together, they were contributing to a much bigger problem. But medications are not the only possible cause. The pattern of your dry mouth can also provide clues. Suppose your mouth is extremely dry when you wake up, but becomes better during the day. That may point towards something happening while you sleep. One possibility is mouth breathing. Another is sleep apnea. During sleep apnea, the airway repeatedly becomes narrow or blocked. Breathing can become disrupted, and many people may sleep with their mouths open. If you wake up with a dry mouth and also experience loud snoring, morning headaches, daytime tiredness, or exhaustion despite getting enough hours of sleep, it may be worth discussing a sleep evaluation with your doctor. Another important combination is dry mouth, with frequent nighttime urination and increased thirst. High blood sugar can cause the body to lose more water through urine, which may lead to increased thirst and dryness. A blood test, such as an A1C, can help determine whether average blood sugar levels have been elevated over the previous few months. Then there is another pattern. If your mouth is dry and your eyes are also dry, irritated, or gritty, An autoimmune condition called Sjogren's syndrome may be one possible explanation. Sjogren's syndrome affects glands that produce tears and saliva. It is much more common in women and often develops around middle age or later. Again, dry mouth alone does not mean you have this condition. The combination of symptoms is what makes it worth discussing. There are other clues as well. A persistent metallic taste or unusual ammonia-like breath can sometimes occur when kidney function is impaired. Dry mouth combined with muscle cramps, especially in the legs or feet, may raise questions about electrolyte balance. Minerals such as sodium, potassium, and magnesium are important for muscles, nerves, and heart rhythm. Some medications, including certain water pills, can affect fluid and electrolyte levels. The point is not to diagnose yourself from these symptoms. The point is to recognize that dry mouth can provide information. Your body may be giving you a clue about medication effects, sleep problems, blood sugar, autoimmune conditions, or other health issues. That is why one of the worst things you can do is simply accept persistent dry mouth as normal aging without asking any questions. Many people hear it is just part of getting older and stop there. But normal aging alone is usually not the whole explanation for severe or ongoing dry mouth. Sometimes the real cause simply has not been investigated, and you can change that with one simple question at your next appointment. Could any of my medications or health conditions be contributing to my dry mouth? That question can open a much more useful conversation. And there is another common question people ask. If dry mouth is caused by dehydration, why doesn't drinking more water solve it? The answer is important. Drinking water is important. But water and saliva are not the same thing. Saliva is mostly water, but it also contains proteins, minerals, enzymes, and protective substances that ordinary water does not provide. Water can temporarily wet your mouth. Saliva does much more. So if you are drinking enough water and still waking up with persistent dryness, do not assume that you simply need to drink more. The next step is finding out why your saliva production is low. The same applies to people who wear dentures. Dry mouth still matters because the tissues underneath and around dentures need moisture and protection. Without enough saliva, irritation and bacterial buildup can become more likely. This brings us back to Eleanor. Her problem did not disappear because she found a miracle product. It improved after someone looked at the entire picture. Her medications were reviewed. Some were replaced with alternatives that were less likely to worsen her dryness. Another medication was no longer necessary and was discontinued under medical supervision. The change was gradual, but eventually, she noticed something simple that she had almost forgotten was possible. She could wake up without her mouth feeling completely dry. Her appetite improved, her weight began recovering, and she did not experience another serious chest infection during the following winter. The lesson is not that every case of dry mouth can be solved by changing medications. The lesson is that the cause matters. So what can you actually do? Start with a simple 2-minute check tomorrow morning. Before you reach for the water beside your bed, pause. Notice your mouth. Is there any saliva? Does your mouth feel completely dry? Is the saliva thin and watery or thick and sticky? Do you have an unusual taste? Do you notice an unusual odor? Can you swallow comfortably without immediately drinking? Write down what you notice. Do this for several mornings. A pattern gives your doctor more useful information than simply saying, "My mouth is dry sometimes." Next, review your medications. Make a complete list of everything you take. Include prescriptions, over-the-counter medicines, allergy products, sleep aids, vitamins, and supplements. Then ask your doctor or pharmacist whether any of them may be reducing saliva production. If you take several medications, ask whether the combination could be contributing to the problem. But never stop a prescribed medication on your own. Even if you believe it is causing your dry mouth, stopping suddenly can create serious problems. A healthcare professional can decide whether a medication should be changed, reduced, replaced, or continued. The next step is protecting your mouth. Some ordinary mouthwashes contain alcohol, which can make dryness worse for certain people. Alcohol-free products may be more comfortable. Saliva gels, sprays, or substitutes can also provide temporary relief. You can also encourage your own saliva production. Sugar-free chewing gum can stimulate the salivary glands. Gum containing xylitol may be useful because it provides stimulation without adding sugar. Sugar-free lozenges can work in a similar way. Food choices matter too. Water-rich foods such as cucumbers, carrots, and other fresh produce provide moisture, while chewing can stimulate saliva. And if dry mouth makes healthy foods difficult to eat, change the texture rather than giving up the food. Use healthy sauces, add broth, choose softer preparation methods. The goal is to keep nutritious foods in your diet. Your sleeping environment can matter as well. Very dry indoor air may make morning dryness worse. A cool mist humidifier can help some people maintain a more comfortable environment while sleeping. But if your dryness is strongest in the morning, also think about your breathing. Do you snore loudly? Do you wake with headaches? Do you feel exhausted during the day? Has anyone noticed that you stop breathing during sleep? Those clues deserve attention. And if dry mouth comes with frequent nighttime urination and increased thirst, ask your doctor whether your blood sugar should be checked. If your mouth and eyes are both unusually dry, mention that combination. If you have unusual taste changes, muscle cramps, or other persistent symptoms, mention those too. The goal is not to become frightened by every symptom. It is to notice patterns and give your healthcare provider useful information, because sometimes a small symptom is the first clue that leads to a much bigger answer. Most cases of dry mouth are not emergencies, but there are certain warning signs that should not be ignored. If dry mouth appears suddenly along with confusion, weakness, chest pain, severe breathing difficulty, or a rapid heartbeat, seek urgent medical attention. If you notice white patches inside your mouth that do not wipe away, it could be oral thrush, a fungal infection that should be evaluated. These situations are different from the ordinary dry mouth many people experience after waking. The important thing is knowing when a symptom needs more attention. For everyday persistent dryness, a simple record can help. Write down when the dryness is worst. Notice whether it happens only at night or continues throughout the day. Record how often you wake to drink water. Pay attention to your appetite. Notice any unexplained weight loss. Watch for changes in swallowing. Look at your gums and teeth. Notice whether your eyes are dry too. Think about your medications. These details can help your doctor understand the bigger picture. A dentist can also play an important role. They may notice signs of dry mouth through tooth decay, gum irritation, or changes in the tissues inside your mouth. Your doctor can look for medication effects or underlying health conditions. A pharmacist can help identify medications that may be contributing. And when sleep symptoms are present, a sleep specialist may be able to determine whether a breathing problem is involved. This is important because the body does not operate in separate departments. Your mouth affects nutrition. Nutrition affects strength. Medications affect saliva. Sleep affects breathing. Oral bacteria can influence other systems. One small symptom can sometimes connect several parts of your health. That is what happened with Eleanor. At first, her dry mouth looked like a small inconvenience. Then she began changing her diet. Her weight started falling. She experienced repeated chest infections. Her medications were contributing to reduced saliva. Once those pieces were connected, her situation made much more sense. This is why you should not always ask, how can I make this symptom disappear? A better question is, what is causing this symptom? That question changes how you approach the problem. Sometimes the cause is simple. Sometimes it requires a medication review. Sometimes it points towards sleep apnea, blood sugar problems, an autoimmune condition, or another health issue. And sometimes several factors are involved at the same time. You do not need to figure that out alone. You need to notice the pattern and bring it to the right person. There are also prescription treatments that may help some people whose saliva production remains low despite other changes. These medications are not appropriate for everyone. Your medical history and other medications have to be considered. That is why they should only be discussed with a qualified healthcare professional. In the meantime, simple habits can help protect your mouth. Drink enough fluids. Use fluoride protection. Keep regular dental appointments. Consider alcohol-free oral care products. Use sugar-free gum or lozenges when appropriate. Choose foods that contain natural moisture. Make nutritious foods softer when needed. Keep your sleeping environment comfortable. And pay attention to your breathing at night. These steps are simple, but they can help protect the systems that saliva normally supports. There is one mistake that many older adults make. They assume that because a symptom is common, it must be harmless. But common does not always mean normal, and aging does not mean you have to accept every persistent change without asking why it is happening. Your body changes as you get older. That is normal. But you also know what your own normal feels like. If your mouth has suddenly become much drier than it used to be, and the change continues for weeks or months, that is useful information. If you are waking up every morning needing water just to swallow comfortably, pay attention. If you are losing weight because eating has become difficult, pay attention. If you are snoring heavily and waking exhausted, pay attention. If dry mouth appears with increased thirst, frequent urination, dry eyes, muscle cramps, or other unusual symptoms, pay attention. You do not need to assume the worst. You simply need to ask better questions. That is one of the most important parts of staying healthy as you age. Noticing, asking, checking, and acting when something deserves attention, because your body rarely sends a warning as a loud announcement. More often, it starts with something small: a dry mouth every morning, a little less appetite, a change in sleep, a few pounds of unexplained weight loss. These details can seem unrelated, but sometimes they are pieces of the same puzzle. And once you start looking at the whole picture, the answer can become much easier to find. Persistent, dry mouth is easy to ignore because it does not always hurt, but now you know that saliva does much more than keep your mouth comfortable. It helps protect your airway, it supports eating and digestion, it helps control harmful bacteria, it protects your teeth and gums. When saliva production decreases, several of these natural defenses can become weaker. That is why persistent dry mouth after 60 should not automatically be dismissed as a normal part of aging. Start with the simple 2-minute morning check. Before drinking anything tomorrow, notice what your mouth feels like. Is it completely dry? Is your saliva thick or sticky? Do you have an unusual taste? Is there an unusual odor? Can you swallow comfortably? Write it down. Repeat the check for several mornings. That simple record can help you see whether the problem is occasional or persistent. Next, look at your medications. Make a complete list of everything you take: prescription drugs, over-the-counter medicines, allergy products, sleep aids, vitamins, supplements. Then ask your doctor or pharmacist whether any of them may be contributing to reduced saliva. If you take multiple medications, ask whether their combined effects could be part of the problem. But do not stop prescribed medication on your own. The goal is not to remove treatment that protects your health. The goal is to make sure your treatment plan still fits your current needs. Then protect your mouth every day. Stay properly hydrated. Use fluoride protection. Consider alcohol-free oral care products. Sugar-free gum or lozenges can stimulate saliva for some people. If dry foods are difficult to eat, add moisture rather than removing nutritious foods from your diet. Use sauces, broths, or softer cooking methods. And pay attention to your sleeping environment. If the air is very dry, a humidifier may help. If you wake with severe dryness and also snore loudly, experience morning headaches, or feel exhausted during the day, talk to your doctor about possible sleep-related breathing problems. If dry mouth comes with increased thirst and frequent nighttime urination, ask about blood sugar testing. If your mouth and eyes are both dry, mention that combination. If you notice unusual taste changes, muscle cramps, or other persistent symptoms, mention those too. These symptoms do not automatically mean you have a serious disease. They are simply clues that can help guide the right questions. And that is what Eleanor's story teaches us. For 2 years, her body was giving her the same signal every morning. She woke up with a dry mouth. She drank water. The feeling returned. She continued with her day. But the underlying problem remained. Eventually, someone stopped looking at the symptom by itself and considered the entire picture. Her medications were contributing, her eating habits had changed, her weight had fallen, she had experienced repeated chest infections. Once these details were connected, the situation became much clearer. The lesson is simple: do not just cover up a persistent symptom. Try to understand why it is happening. Sometimes the answer is a medication. Sometimes it is mouth breathing. Sometimes it is a sleep problem. Sometimes it is blood sugar. Sometimes it is an autoimmune condition. Sometimes several factors are involved. and sometimes the cause is less serious than you feared. You cannot know until you look. That is why staying healthy after 60 is not about becoming obsessed with every little change. It is about becoming aware. Your body will not always give you dramatic warnings. Sometimes it gives you quiet signals: a dry mouth, a change in appetite, difficulty swallowing, unexplained weight loss, poor sleep, a new pattern of thirst. The earlier you notice those changes, the sooner you can discuss them with the right professional. Your doctor can review your medications and possible medical causes. Your dentist can check your teeth, gums, and oral tissues. A pharmacist can help identify medication side effects. A sleep specialist can evaluate breathing problems when appropriate. You do not have to solve the problem by yourself. You just need to stop ignoring the message. So tomorrow morning, before you reach for that glass of water, take 2 minutes. Pay attention. Notice the pattern. Think about your sleep, your medications, your appetite, and any other symptoms. Then take that information with you when you speak to your healthcare provider. A small observation may lead to an important conversation, and sometimes that conversation is exactly what you need. Getting older does not mean you have to accept every uncomfortable change as unavoidable. You deserve to know what is happening inside your body. You deserve to ask questions, and when there is a treatable cause, you deserve to know about it. So if you regularly wake up with a dry mouth, do not panic, but do not ignore it either. Listen to the signal, look for the pattern, ask the right questions, and take the next sensible step. If this video helped you understand what persistent dry mouth may be telling you, subscribe to the channel for more simple, practical health information, and share this video with someone who wakes up every morning with the same problem. Your body often gives you small clues before bigger problems become obvious, and knowing what to look for can make those clues much easier to understand.